Hi everyone, my name is Jamie and I am a labor and delivery nurse and a doula, and I'm here to talk to you about your cervix today. So your cervix is actually at this is my uterus for today. The cervix is actually at the base of your uterus. It is what keeps the baby inside. So typically your cervix will stay closed until it's time to start going into labor. So when they are checking your cervix, they are actually feeling the bottom segment of your uterus where your cervix is to see how open, thin, and high or low that cervix is. So that is what they're checking when they say dilation, is how far dilated are you, how open is your cervix. Then effacement is how thin is your cervix. So a normal sized or normal thickness cervix is usually about 3.5 centimeters. So technically, if you just go almost to your knuckle, that is how thick a cervix is that has not thinned out at all. And then they also will talk to you about your station, which is in relation to your pelvis, and these little guys down here called your ischial spines. So that is how baby is engaging into the pelvis and how far down or above those ischial spines baby is. So when would they want to check your cervix? If for some reason they thought you were in preterm labor, they would want to see if your cervix is changing. If you go to your office visit in your past 37 weeks, they may offer you an exam to get an idea of where you're at. You can walk around with your cervix dilated and thinned out, especially at the end of your pregnancy. That's not completely abnormal because your cervix is softening and getting ready for labor. And they may also ask, or if you're coming in to triage to see if you are in labor, they will ask if you want, they will offer you a cervical exam to see if you can be admitted for labor. Active labor is 6 centimeters, and preferably they want you to get to the hospital when you're around 4 to 6 centimeters to be admitted. Another time that they will offer to check your cervix is during labor to have an idea of if you're progressing or not. So dilation can be anywhere from 1 to 10 centimeters. Here is a little guide. So this would be 1 centimeters all the way over here, and this is 10 centimeters all the way over here. Spoiler alert, you do not actually have to be 10 centimeters. It just means that your cervix is completely gone. So whether your baby's head is 8 centimeters, 10 centimeters, 12 centimeters, that is when your cervix is just completely gone, is when they say 10 centimeters. Effacement is going to go from 0, which is no thinning at all, to 100%, which is just as thin as a piece of paper. You can almost barely feel it if you're reaching for it. And then station is going to be a minus number if it is above these ischial spines. So if you're sitting up here in the pelvis, it will be a minus number up to -3. My fingers go to -3. You can hear people say -4, -5. If they're saying that, that just means that the baby is not totally engaged and they can't necessarily reach it, or they're just brushing the baby's head with their finger when they are checking your cervix. And then you will get plus numbers when you're going past these ischial spines. So I usually say +3, +4 is floor, aka baby's on the pelvic or the perineum and ready to be born. Things you should also know about a cervical exam is you always have the right to decline. It's not always a necessary procedure, and if you have a history of some type of trauma, I can understand why that would be very triggering, and it's definitely an honest conversation that you want to have with your provider beforehand or during to let them know why you're uncomfortable with it and if there's any other alternatives. 0 and 10 are the most important, honestly, and so if your body is going to have a baby, you'll have a baby at 10 centimeters without having your cervix checked, if that's the case. The other things that I'd like you to know is that it can change a little bit from person to person. So if you're in the office and they say you're 2 centimeters, and then you go into the hospital and they say that you're 1.5 centimeters, same thing. So different people have slightly different judgments, and it'll be slightly subjective, but it's not a big difference, and don't think you're going backwards. Also, just because your cervix hasn't changed does not mean it won't change in an hour, 2 hours, tomorrow. Do not base your labor progress strictly on the numbers. Listen to your body, listen to your instincts, and know that your cervix will change and do what it's supposed to do. Lastly, if you do have your cervix checked, you can have some bleeding. Usually it's less than 24 hours, and it would just be some pinkish brown when you wipe. Usually it should never look like a period. Of course, if it does, you would want to call your provider. So those are a little rundown on vaginal exams, cervical exams. It is not your vagina opening, it is your cervix opening. So once your cervix is all the way open, that is when baby's able to come down through your vagina. So the cervix and your vagina are different. Good luck with everything, and I hope this gave you some information that you didn't know. All right, have a great day, guys.